Welcome to Medicam Tube. Today we're diving into the world of hematologic malignancies. Specifically, we'll be comparing leukemia and lymphoma, two serious, life-threatening conditions that affect the blood, bone marrow, lymph nodes, and other components of the lymphatic system. Let's jump right in. First up, leukemia. Leukemia is a cancer of the bone marrow and blood, caused by the uncontrolled proliferation of abnormal white blood cells. These rogue cells interfere with the production of normal blood cells, leading to a host of symptoms. Leukemia is classified based on the rate of progression, acute or chronic, and the type of white blood cell affected, lymphocytic or myelogenous. Acute leukemia progresses rapidly. In acute lymphocytic leukemia or ALL, immature lymphocytes crowd out normal cells. ALL is most common in children but can also affect adults. Acute myelogenous leukemia, or AML, affects myeloid cells and is more common in adults. Immediate treatment is essential for acute leukemias. On the other hand, chronic leukemia progresses more slowly. Chronic lymphocytic leukemia, or CLL, involves mature but abnormal lymphocytes and is most common in older adults. Chronic myelogenous leukemia, or CML, affects myelogenous cells and can progress slowly before potentially accelerating. Symptoms of leukemia include fatigue, frequent infections, unexplained weight loss, fever, night sweats, easy bruising, and swollen lymph nodes. Diagnosis involves blood tests, bone marrow biopsy, and genetic testing. Treatment options range from chemotherapy and targeted therapy to stem cell transplants and immunotherapy. Now, let's shift gears to lymphoma. Lymphoma is a cancer of the lymphatic system, beginning when a type of white blood cell called a lymphocyte becomes malignant. Lymphomas are divided into Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma is rare and characterized by Reed-Sternberg cells. It typically affects younger adults and has a better prognosis than non-Hodgkin lymphoma. Non-Hodgkin lymphoma, or NHL, is more common and includes various subtypes like diffuse large B-cell lymphoma and follicular lymphoma. Symptoms of lymphoma include painless swelling of lymph nodes, unexplained weight loss, fever, night sweats, itchy skin, and shortness of breath. Diagnosis involves physical examinations, biopsies, imaging tests, and blood tests. Treatment options include chemotherapy, radiation therapy, immunotherapy, stem cell transplants, and CAR T-cell therapy. Prognosis for Hodgkin lymphoma is generally good, especially with early diagnosis. Non-Hodgkin lymphoma varies widely depending on the subtype, with some forms being indolent and others highly aggressive. Risk factors for hematologic malignancies include genetic mutations, family history, age, environmental exposures, and immune system deficiencies. To wrap it up, leukemia and lymphoma are complex but distinct hematologic malignancies. Advances in treatment, including targeted therapies and immunotherapy, have significantly improved survival rates. Early diagnosis and personalized treatment plans are crucial. Ongoing research continues to improve the prognosis and quality of life for patients. Thanks for tuning in to Medicam Tube. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more medical insights. Stay curious and keep learning.